Patients are sleeping on the streets. Families are being forced to split. For over 60,000 residents, Hong Kong has become inhabitable. Thousands are now leaving the city. Our next report tells you about Hong Kong's mass exodus. Hong Kongers are living a nightmare. The Wuhan virus has brought the city to its knees. Hong Kong has the world's highest death rate right now. New infections have skyrocketed. The health system is crumbling under the weight of new cases. Patients are being forced to sleep on the streets just to protect their loved ones from an infection. The situation is so dire that people are leaving Hong Kong. We're talking about a mass exodus. For 3 weeks straight, more than 20,000 residents have left Hong Kong every week. Just last week, close to 23,000 Hong Kongers left. On Sunday alone, more than 5,000 people left. Reports say these are record numbers. Why are so many Hong Kongers leaving? Because of China's poor pandemic response. The Omicron variant triggered the latest tsunami of cases in Hong Kong. The wave began almost 3 months ago, but local authorities have struggled to contain its spread. Critics say that Hong Kong has been confused about its response. For several days now, the government hinted that it wants to impose a total lockdown. There was too much back and forth. First, they ruled out the lockdown. Then they revived the plan. Hong Kong's health secretary says that a lockdown is still being considered. Similar confusion exists over the testing strategy too. Hong Kong has tried to copy mainland China's zero COVID policy. A mass testing strategy was announced. All 7 million residents were asked to take 3 Wuhan virus tests. The plan was widely criticized. The leader of China's COVID response team opposed it too. He suggested that Hong Kong should focus on reducing deaths. But the city's chief executive, Carrie Lam, remains adamant. She says that the mass testing plan is still on.
First of all, with regards to compulsory universal testing, it remains a project we are making plans for. But naturally, as to when we will start this, it all depends on the development of the pandemic. We also have to consider the best timing for testing for it to be the most effective. But then we need to make other preparations first. Otherwise, there's still no chance for us to launch it.
That statement only led to more panic. Residents rushed to grocery stores. There was panic buying of essentials from food to medicines. Public schools were told to start summer holidays early. Their campuses will be used now for mass testing. Those who test positive will be sent here. It's a massive quarantine center in the middle of the city. Non-compliance will lead to steep fines. Already, families are being forced to split. For many, the mental toll of isolation has been severe. Last month, at an isolation center, 4 people tried to commit suicide in a day. For one of the former inhabitants, the quarantine center was like living inside a madhouse. Who can then blame Hong Kongers for trying to